Imagine a world where children with Duchenne muscular dystrophy can live longer, healthier lives, free from the debilitating effects of this devastating disease. This vision is now closer to reality thanks to the groundbreaking announcement from the Muscular Dystrophy Association, MDA, and Parent Project Muscular Dystrophy, PPMD, regarding their joint consensus guidelines for the safe and equitable delivery of gene therapy in Duchenne Muscular Dystrophy, DMD. But here's where it gets controversial. With the FDA approval of the first gene therapy for DMD in 2023 and more therapies on the horizon, the need for standardized guidelines has never been more pressing. And this is the part most people miss: the importance of experienced, multidisciplinary care teams, standardized protocols for monitoring and managing adverse events, real-time safety surveillance, and transparent reporting. The MDA and PPMD have joined forces to provide a comprehensive framework for patient selection, institutional readiness, safety monitoring, and follow-up, ensuring that patients receive the best possible care. The guidelines, developed in partnership with cardiologists from the Advanced Cardiac Therapies Improving Outcomes Network, Action Network, and experts from 15 leading MDA and PPMD clinical care centers, are a testament to the power of collaboration and the unwavering commitment to improving the lives of those affected by DMD. As Sharon Hesterly, Ph.D., Interim President and CEO of the Muscular Dystrophy Association, so eloquently put it, these recommendations are the result of a truly collaborative effort between the medical and advocacy communities to protect patients while advancing access to innovative treatments. But what does this mean for families affected by DMD? In essence, these guidelines provide a clear, consensus-based roadmap for care centers to navigate the complexities of gene therapy administration, from patient evaluation to post-infusion monitoring, giving families more information for their decision-making. Pat Furlong, founding president of Parent Project Muscular Dystrophy, emphasized the critical need for consistent, evidence-informed standards for the administration and monitoring of gene therapies, stating, "These guidelines provide clinicians with a unified framework for evaluating eligible patients, delivery of the therapy, and support for patients during and following infusion." Dr. Barry Byrne, MD, Ph.D., director of the Powell Gene Therapy Center at the University of Florida and member of the MDA Board of Directors, led the team that developed these guidelines, highlighting the importance of specialized expertise and vigilant follow-up in the safe and effective delivery of gene therapy. So, what's next? Families can contact the MDA Resource Center and the MDA Gene Therapy Support Network for guidance and support, and learn more about the MDA Care Center Network. Additionally, families can visit PPMD's Gene Therapy Hub for insights and guidance to help them better understand the dynamic landscape of gene therapy. As we move forward, it's essential to acknowledge the controversy surrounding the accessibility and affordability of gene therapies. Will these guidelines be enough to ensure equitable access to these life-changing treatments? We invite you to share your thoughts and opinions in the comments below. About the Muscular Dystrophy Association, the MDA is the #1 voluntary health organization in the United States for people living with muscular dystrophy, ALS, and over 300 other neuromuscular conditions. With a mission to empower people to live longer, more independent lives, the MDA has led the way in accelerating research, advancing care, and advocating support and inclusion of families living with neuromuscular disease. About Parent Project Muscular Dystrophy, PPMD fights every single battle necessary to end Duchenne, demanding optimal care standards, ensuring access to expert healthcare providers, cutting-edge treatments, and a community of support. By investing deeply in treatments for this generation of Duchenne patients and in research that will benefit future generations, PPMD is committed to helping those with Duchenne live longer, stronger lives. Join the fight against Duchenne at endduchenne.org.